not going to school, they're shutting down, they're maybe withdrawing from friends. We're seeing a major impact to their daily functioning day to day. And so they need a more structured level of care. And so it's essentially, I look at it as like the next step from outpatient therapy, essentially. So one-on-one therapy once a week is not working. Maybe they flatlined in their support outpatient, and now they need a more structured approach to care. Well, my name is Brittany Skinner. I am a master's of social work graduate, as well as an associate clinical social worker. The best way that I like to explain it is IOP, or intensive outpatient, is a step up from outpatient therapy. And so this is for like a teen who's not going to school, they're shutting down, they're maybe withdrawing from friends. We're seeing a major impact to their daily functioning day to day. And so they need a more structured level of care. And so it's essentially, I look at it as like the next step from outpatient therapy, essentially. So one-on-one therapy once a week is not working. Maybe they flatlined in their support outpatient, and now they need a more structured approach to care, where they can learn more skill-based things like that. So I think it's just more of like a step up from that outpatient level of care and just needing more structure, essentially.
What's helpful for us is we're not just here to, I guess you can say, remedy the symptoms. So they might come in with a bunch of different symptoms. We're not just here like, here's some medication, quote unquote, here's the symptoms are going to be gone. We are here for building long-term coping skills. So we want you to be able to gain practical tools that you can use down the line, because ultimately you're going to go through more circumstances that might put you back into a depressive state. And we want you to be able to at least know how to manage it and know how to tolerate that, distress that you might be experiencing. And so we're understanding of the fact that recovery is a journey. It's not just something that is remedied right away. And so we are with you every step of the way. We're providing you with resources. We're making sure the families are involved. And I think that's what kind of takes us a step further than just like one-on-one individual therapy. Like, we're making sure the full community is involved and that they are provided with all the long-term resources that they need, and whatever that might be for them. So we're really getting to know them. We're really understanding what the needs are. If they have a desire to build connection, then we're connecting them with resources in the community that can allow them a space to be able to build connections with like-minded individuals. So we're really allowing the full community to come together and support this individual and their whole self, and not just those symptoms that we're getting presented with right away when they come in here. No, they're not. So we, for our adolescents, we do programming after school hours, which is from 4 to 7. And so no, they should not be missing any type of school. And so that's what I think is really beneficial about our program, is that they don't have to miss out on this schooling portion of it. That's super important for us as well. And so no, they don't have to miss school to be here.
Being an intensive outpatient program, we're really allowing them a safe space to just be heard. And so a lot of the times, like at home, they don't feel like they're able to communicate about their feelings, or they just don't know how to. And so really we're creating that space of comfortability so that they know, hey, you can talk about these emotions and you're going to be heard here, and you can relate, because there's other teens here that also understand and they get it. And so we're learning a bunch of different things, but it starts with the comfortability and the openness to even be upfront and honest about what they're feeling. But as far as like the skills, we're very practical with our tools here. And so we're utilizing grounding techniques, which is probably my favorite, because it's bringing that awareness to the body. And so a lot of times, like with our teens, they're not able to, or they may be afraid to communicate their feelings right away, or they may not even know how to identify their feelings. And so we're teaching them grounding techniques to first just be aware with their body, be present with their body. And then that can kind of help them to be able to eventually open up about kind of more of what they're feeling. But we're teaching a lot of practical tools. So day-to-day skills, even if that's like time management or decision making, and things like that.
For our teens specifically, we utilize music therapy. I think that music therapy is absolutely phenomenal because, one, teens love music, just to start with that. And it gets them feeling like they can build that connection. Because a lot of the time, like, we're building rapport in the beginning. We're just trying to get them comfortable again and get them open with us. And so the music therapy really allows them a different skill and a different technique of how to communicate what they're feeling, and kind of like more so it's more relatable, I guess you can say. And so I think that we've seen tremendous work with the music therapy, because a lot of the times there's teens that don't feel comfortable talking, but they can utilize music, or they can interpret their feelings and their emotions through a song that they like or a song that they've heard. And it really allows them to be able to share their thoughts and feelings in a unique way, but also to build that connection, because a lot of the time our teens enjoy similar genres or music and things like that. And it's a more creative way for them to communicate with each other and with us. And then they also do improv, which I think is super cool. It's really a creative and engaging, fun way for them to utilize their social skills. And so they are challenged quite a bit, because it can be uncomfortable, but it gets them thinking on their feet, and I really love that. And our staff even participates in that, which I think is super special, because a lot of the time they don't feel like they can relate. They're like, the staff, they don't have the same experiences, they don't understand where I'm coming from, and so we participate, and we're thinking on our feet as well. And it's just so amazing to see how creative our minds work together. And so I really enjoy that aspect, and I think that it really helps them as they go to school as well, challenging themselves as they're having to interact with other peers and different environments and things like that. So I feel like improv especially has been a really creative, cool way for our teens to engage in their social skills and expand in that way. Your teen is not broken. With the right support, they can heal and thrive.